signs of autism in 2-year-old children. What are the main factors that we need to observe in our little ones? What are the main things we need to pay attention to when they are 2 years old or around that age, so that we can make a quick intervention and try to address these delays in children? The first and most important thing is the autism triad, which is the difficulty in social communication, the speech delay. 2-year-old children need to make sentences, putting together little words with verbs. 2. Tell things. 2. Ask questions. 2. Share with parents what they are doing. 2 little words don't mean just repeating numbers and letters, things they like, things they have a restricted interest in, and that they do alone. It means interacting with others. It means asking questions. It means sharing. It means at a moment when something falls. It means looking at the parents and saying that the bottle fell. It means saying that the ball is blue and sharing with dad, "Look how cool, a blue ball." That's what it means to say 2 little words together at 2 years old. And not just talking to themselves, a movie scene or singing. The child needs to talk with the purpose of communicating. This is what stands out the most to parents who think that the child might just need more time to talk. That may have a delay and may not. Sure, actually 2 years is the limit for that. They need to have a very broad communication repertoire. Since they are 1 year old, they should be saying little words with those same intentions. Another important factor that catches parents' attention is eye contact. People think that children with autism don't look into your eyes. That's not true. They do look, yes. They do communicate, yes. But they do all of this less than they should. In terms of frequency and intensity, so glancing into your eyes, seeing you from time to time is a common thing. But children, since they are babies, at most by 1 year old, they need to respond to their names and maintain eye contact with their parents for several seconds, exchanging smiles, babbling, exchanging information. When the dad asks her to look at something, she looks and then returns her gaze to dad. This is the third symptom, the third sign. Shared attention. I show things and the child looks away and then looks back at me. She likes to keep looking. She waits with her gaze for what I'm going to do. So children with autism have a harder time. They have an area of the brain that gets activated, which in typical children is activated when looking at other human beings. In children with autism, this activated area responds to bright lights, angles, materials, and repetitive movements. This is another symptom. They enjoy repetitive movements, bright lights, and seek these out in materials. That's why it's common for them to spin wheels, and why it's common for them to keep opening and closing doors and drawers. That's also why they often just keep looking. That's why it's common to spin wheels, and that's why it's common to keep opening and closing doors and drawers. That's why it's common to keep looking. Little leaves, moving or looking while making movements with their own hand, and using objects for this kind of exploration. At this age, the child also has less imitation than her peers. So, when we ask her to stick her tongue out, to say goodbye, to blink her eyes, or to clap her hands, she does it less than the other kids do compared to children her age. They tend to ignore and do what they want. Sometimes they do one or another imitation because it is in their interest. But to give us an idea of the proportion, it's important for her to look, imitate, and also follow a command 70% to 80% of the time when we ask her to. So another characteristic is a lower attention to the commands that we give. Like commands, for example, when you're changing the diaper and you ask the child to throw it in the trash, or when she has a cup in her hand and you ask her to put it in the sink. These commands are conditioning. She has already seen you doing it many, many times. She has also done it many, many times What we need to observe is whether she does things differently from her routine. She follows your commands when you ask for something new. So if you ask her to take the same diaper and put it under the bed, or take it to the laundry, will she do that? Or for her, will she put it in the trash again because that's what she's used to doing? If you ask her this time not to put the cup in the sink, but to hand the cup to daddy, or to put it on top of the TV, will she do it? Why is it important for us to know this? Because following commands means understanding language. It means to understand and process the meaning of sounds, and that is communication. And this will be important for the time when speech develops. So what if the child doesn't respond to different things that you never asked for? 70% to 80% of the time, they need to pay attention. Things that you never asked for, but that she knows the meaning of. She has to know what a television is for you to ask her to put something on top of the television. She needs to know what it is. Laundry, to take the diaper, she needs to know what a bed is for you to ask her. To put it underneath, she needs to know the meaning of those things. But one thing that you never asked for. So you also need to observe. Also observe an item that is the repetition of behaviors. Does the child always want to do things the same way? She takes the toys and lines them up. She keeps doing that. It's within a repetitive pattern. Is she also doing another thing, which is repetitive movements with her body? Generally, motor stereotypies, which are the rocking, the flapping, or movements of running back and forth, appear more after the age of 2. Head rocking, repetitive, without function. Running back and forth movements appear more after the age of 2. Head rocking, repetitive, without function. It's also important to observe these repetitions with toys always in the same way, and also motor repetitions. There are 2 more important items for us to observe. It's very important to observe if the child is willing to play the way other children her age do. What is this play like? She stays close, she stays nearby, but is she only doing what she wants? Or does she observe, imitate, participate, let the friend also do a little bit? It's a back and forth of play. She is alone in her little corner nearby, and there's no interaction at all. And worse, she gets upset, doesn't allow, prevents when someone wants to touch her things. We often confuse these behaviors with being spoiled, and we have countless excuses for all of this not to happen. We think, oh, it's because she doesn't have siblings, she's not used to it. Oh, but 2-year-olds do play by themselves. Yes, they play, but they also play together with each other. They also share a bit of their experiences. So, what is this play like? Is there a way to play? Is there a relationship? Is there contact? Or does she just keep doing her own little things near other kids without any interaction? Another important thing is the difficulty in getting out of the routine. When we change a path to get to a certain place we're creating, the child gets angry. No, and you know that this path has changed. Memorizes, very easily maps, but has difficulty getting out of other routines. Like, for example, when you change something that's in the script, you're going to school, but then you decide to stop somewhere else first, or even at home. When you do something different, she always wants to keep the same patterns, always doing things the same way. Another important thing is the difficulty in identifying emotions. Change something that is within the script, you are going to school, but then you decide to go somewhere else first, or even at home. When you do something different, it wants to always maintain the same standards, always things being done the same way. Another important thing is the difficulty in identifying emotions. That moment when the house is falling apart, when everyone is upset, something has happened, the parents are crying, and there's something or a TV scene that has a sad moment happening. And the child doesn't notice, doesn't pay attention to it, continues playing with his things, sometimes asking his parents something at a really inappropriate time, or laughing at scenes where the child should feel empathy, realizing that it would be a bad thing. When the parents are angry, upset, fighting with her, she laughs instead of picking up on that subtlety of emotion. At this stage, children already have a mirror neuron system. When the parents are angry, upset, fighting with her, she laughs instead of picking up on that subtlety of emotion. At this stage, children already have a mirror neuron system They already have a system for processing social cognition that makes them tend to feel the same thing as their parents. So, if the parents are distressed, or if something sad and distressing happens on television, the child also tends to make the related corresponding expression. But children with autism have difficulty with that. If you notice these or other behaviors in your child, please share them in the description of this video or in the comments. This can really help other parents. And look for a behavioral team that works with ABA, that works with science, that develops, that recovers, that is therapeutic for developmental delays. Run to look for help even if you don't have a diagnosis. Don't keep thinking, but my child is so little. I'm already going to start therapy. Yes, the sooner we start, the better for us to treat it. The more chances he has to recover. If this video helped you, give it a like and share it so more people can know about it.
Thank you for watching us so far. Take the opportunity to follow us on social media to see more content. The links are in the video description. And don't forget to like, comment, and subscribe. See you in the next video.